Did you know that antimicrobials, such as Lysol, can cause health problems? According to healthcanada.org, the term antimicrobial refers to all types of natural and synthetic drugs which may kill or slow down the growth of microorganisms. Overuse of antibacterial, also known as antimicrobial, may have negative effects on your health. I want to provide you with a clear and specific understanding of the harmful effects of the excessive use of antibacterials. Let me begin by sharing the different types of antibacterials. We have antibiotics as well as antiseptics. Antibiotics refers to medication that fights off infections. Antibiotics can be bactericidal as well as bacteriostatic. Bacteriostatic antibiotics stops the growth of the infection, allowing your immune system to fight off the infection. Bactericidal kills off the infection and in the process wipes out your normal flora. Antiseptic refers to skin disinfectant. Examples of antiseptics include chlorine wipe, sanitizer, alcohol, as well as peroxide. These are things that you use in your normal daily life. To understand the health problems related to antibacterial use, let's look at something called the hygiene hypothesis. What is the hygiene hypothesis? This is the hypothesis that the lack of stimulation of the immune system with bacteria, viruses, could lead to a higher rate of asthma and allergies. Study shows that the immune system stimulation begins at birth. Study shows that vaginal birth is more beneficial than a C-section birth. This is true because the baby is introduced to bacteria when it's coming through the vaginal canal. Study also indicated that the use of antibacterial in the first year of life have been linked to asthma as well as allergies. The evidence used to support these studies indicate that allergic diseases such as hay fever and asthma are less common in large families as well as the developing countries such as Africa or the developing nations. It also indicates that allergy and asthmas are less common in a big family. To understand the hygiene hypothesis, it is important to know how allergies develop. Allergies are caused by unusual immune response to things that we encounter and tolerate without a problem normally. The first encounter is when your body is exposed to an allergen and builds up your immune system, builds up antibodies. These antibodies are called your memory B cells, which your memory B cells are basically what you use to fight off the infection if you encounter the same infection later on. During the second exposure, your body recognizes the infection. It says, okay, I've made antibodies to you previously. I know who you are. I know how to take care of you. Now that we know what the hygiene hypothesis is, and we have an understanding of how allergies develop, let's talk more about the diseases associated with the overuse of antibacterial. Let's talk about asthma. According to the National Heart and Lung Institute, asthma is described as a chronic lung disease that inflames and narrows the airway. In this picture, you can see a normal airway as opposed to one during the asthma symptom. Symptoms of asthma include coughing, wheezing, shortness of breath, and tightening of the chest. The goal of treatment is to control the disease because there is no cure for asthma. The disease is controlled by using inhaled corticosteroids, as well as making an asthma action plan and avoiding things that worsen your symptoms, such as smoking, pets, anger and pollen. Allergies was described by the Mayo Clinic as the sensitivity to substance called allergens that come into contact with the skin, your nose, your gastrointestinal tract, or your respiratory tract. Symptoms of allergies include hives, itching, rash, watery eyes, difficulty breathing, difficulty swallowing, swelling, as well as unconsciousness. Treatments for allergies include an epinephrine shot, allergy shots, or over-the-counter corticosteroids. a better understanding of the effects of the excessive use of antimicrobials, specifically that of antiseptics. I leave you with this. Do the antimicrobials you use on a daily basis do more harm than good?